Coronavirus in pregnancy, and what does it look like to contract COVID-19 and develop symptoms while you're pregnant? This has been a big question on a lot of women's minds, and I've been receiving this question every single day, multiple times a day. So to help answer this, I'm bringing on an OB-gynecologist, Dr. Rebecca Angelica, who is based in Italy, which is where we have one of the largest outbreaks right now of coronavirus. So she's going to be speaking with us about what it's like to be a doctor in Italy right now, but also answering questions surrounding pregnancy, postpartum, breastfeeding. So if you know anyone who could benefit from this, please share this information right now. So tag a friend, go ahead and forward this along. I'm Dr. Jolene Brighten, and I'm honored to have you here. As I bring her on, please let me know, where are you at in the world?
All right, so I see Lauren's jumping on here. We've got Giselle coming on, giving me a thumbs up. Is this information going to be helpful for you? If not for you, someone you know. Hi there.
Hi.
How are you?
Hi, I'm good. How are you?
I'm doing well. Thanks so much for taking the time to do this today.
No problem. I think it's very important to raise awareness on this matter. It's something that we've never experienced before, thanks God. And so we're all dealing with something new. And the more we can spread correct information is the best way to keep people out of panic and also keep them safe. So thank you for the opportunity to share my experience.
Absolutely. And if you guys aren't already following her after this interview, you're going to definitely want to do that, because you've been putting out great information surrounding this virus and people developing COVID-19. So just to kick this off, because not everybody's going to know who you are. Who are you? What do you do? Where are you at in the world?
Okay, so my name is Rebecca. I'm a medical doctor in Italy. I'm specialized in gynecology and obstetrics, and my primary focus is fertility. So this basically is my description of my job. And I live in northern Italy, which is the part of Italy which has had the majority of cases.
Yeah.
And yeah, that's it.
Yeah. No, and that's why I wanted to bring you on, because I've gotten so many questions about, okay, what if I'm pregnant right now? What if I'm about to have a baby? What if I'm breastfeeding? And I wanted to bring on an OB-GYN who could talk about that specifically. And when you sent me that DM on Instagram asking me to share your information, I was like, who better to talk about this than someone who is based, in the US? We haven't been hit yet, like Italy has, with this level of outbreak. So let's talk a little bit about like what your day-to-day routine, that's the word I'm going for there, what that looks like right now for you.
Okay, right now, my life has changed completely from before, because I've ended my job in the hospital in December and started working privately. So right now I'm doing telemedicine at home because I'm in quarantine since I don't work at the hospital. So my day-to-day routine right now is staying at home, dealing with my patients online, through the computer, trying to keep them well informed, following their pregnancies and all of their gynecological problems as much as I can, but not actually seeing them physically. What we have done in my neighborhood, for example, my husband and I, my sister, since we are young, we're 30, and we have a better immune system than the elderly, for example. Even if coronavirus affects everybody, we're trying to keep the elderly as safe as possible and people with other diseases. So we're trying to organize to do the shopping for them, to buy their medicine, so that they don't have too many contacts with the outworld.
That's great. I've seen so many people doing that, and you guys, that's one way that you can help. If you know someone who's elderly or immunocompromised, offer to go to the store for them, offer to pick up their medications for them so that they don't have to be out and exposed. Now, I'm curious, you have pregnant patients right now. You're not able to do physical exams. What happens when it's time to have a baby?
Well, basically, you must go to the hospital. As you would in a normal situation. That is also true if you have an emergency. So I don't know if you have a third trimester bleeding or something that's wrong. You don't feel the baby moving anymore after you've surpassed the 20-week stage. So yeah, any emergency, or if you need to deliver a baby, you must go to your hospital as usual. But if you can avoid any other physical examination, the questions you might have that can be solved via computer, then it's best you stay home and you contact your physician that way. For example, if you have gestational diabetes, which can be quite frequent, because we're postponing maternity to older ages. So it's this type of problem during pregnancy is more frequent right now. And one of the reasons is this case. You can deal with that from home, because you can have kits for measuring your blood glucose level. You can keep a diary, and you can contact your gynecologist and just tell them, I've had these type of results. What should I do? Is it okay if I keep on, controlling my glucose level with my diet, or should I go on insulin? And so you can do this type of stuff without having a physical contact, a physical evaluation. So stuff like that you can continue doing without seeing the person. Other things like ecographic scans, you can't. So I would limit the most the examinations to the ones that you really must do. Like if you have an ecographic scan, one of the 3 basic scans, you should have one in the first trimester, one in the second, and one in the third, then you must go, talk to your gynecologist. Just go to appointments in which your physician can organize and have nobody there, so you won't get in contact with other people.
Do they have to go alone, or is it just that they're going to have no one else in the room?
No, it usually, especially during not initial pregnancy, but later on during the pregnancy, it's always best to have somebody who accompanies you. So basically, since when you're in quarantine, you can stay with your husband, you can stay with your family members as long as you're living in the same home. Then you can have your husband carry you to the facility to have the ecographic scan. The only problem is it's best if your physician knows you're going and can organize to have nobody else, no other patient there,
so no exposure.
Yeah, exactly. And to disinfect everything before you come, so that all of your contacts with the outer world are basically low risk or zero risk.
Yeah. So for everybody who's just joining on, Rebecca is a medical doctor who specializes in gynecology and obstetrics in Italy right now. She's answering questions regarding how are they handling pregnancy. And there's a great question that just came in from Dr. Vincent Pedre asking what drugs are being used in pregnant women with COVID-19.
That I know of, we're not using hydroxychloroquine. Right now, I'm not aware of any case of COVID-19, serious, COVID-19 cases in pregnant women. There are not many differences between a pregnant woman and a woman outside of the pregnancy. So basically, if the symptoms are mild, you're supposed to stay home and just, check your temperature, check how the symptoms are going, call your physician and keep them updated on your status. But apart from that, there's really no difference between a pregnant woman and a woman who's not pregnant. That I know of, we have no serious case of pregnant women, but information coming out of the hospital is very difficult to obtain. I have colleagues who keep me updated, but obviously I cannot be updated on the whole status of Italy. I know about the majority of hospitals here in northern Italy, but maybe this is something that will come out later on. I have no knowledge of that right now.
Yeah, so I think that's really great for people to hear that at this time, women who are pregnant, we are not seeing severe cases like we are seeing in immunocompromised and elderly. I know a lot of people are, concerned about that because in pregnancy, we know that there are some things women are more susceptible to because of the shifts in their immune system. But It's the same thing with colleagues of mine who are in the hospitals as gynecologists and actually delivering babies now. And they're like, we're not seeing severe cases of COVID-19. But just like Rebecca shared with you guys, more information is coming out every single day. And we are all around the world trying to keep information flowing so people get it as it's coming out.
Exactly.
And I know there was a question here about what supplements would you recommend for pregnant women to boost immunity? And that's actually something we don't recommend in pregnancy, is we don't want to be taking immunostimulating herbs because the body has a wisdom to shift the immunity to protect baby. And so you have to be really cautious with herbs, especially in pregnancy. Most prenatals have vitamin D, vitamin C, beta carotene, things that are supportive of the immune system as it is. I don't know if there's anything else that you would want to add with that.
I just want to share a comment, which is not just about COVID-19, but it's about natural remedies. Not everything that is natural is safe. So I know we always like to hear that what we're taking is natural, it comes from the earth, and it makes us feel more confident and comfortable with taking it. But natural does not equal safe. So please be very careful, especially with those people who are trying to sell you stuff. To not take natural products which have not been tested, because very frequently the natural products that they're trying to sell you don't have like a dosage, a precise study that has been done by real scientists. So be careful. Natural does not equal safe. What I would recommend to boost immunity, to be stronger to facing this infection as any other infection during pregnancy and out of pregnancy is eating well and sleeping well, sleeping the correct amount of time, and eating good food, which means you need to have your veggies, you need to get your proteins, you need to drink a lot of water, because remember, the amniotic fluid in which your baby is dancing and swimming is made of water, so you need to drink. And also, if you don't drink enough and you're dehydrated, then you can get contractions. And since we're all a bit anxious right now and we tend to forget about drinking, you might have contractions which are not related to your labor, but still you might get scared because you're having contractions. So that will lead you maybe to go to the hospital for something that you could have completely solved by drinking water. So these are the recommendations I would give.
Absolutely. So, and I really appreciate you highlighting that. So one thing Dr. Vincent Pedre was saying, I read that vitamin A is not safe in pregnancy. And that is something I've really been cautioning people with, because vitamin A is supportive of the immune system. We know this. We have great studies to show that without vitamin A, our immune system can't do its job. But in pregnancy, if you take retinol palmitate or these certain forms of preformed vitamin A in high doses, like some people are out there talking about, some people are saying taking 100,000 IUs. That's a teratogen in pregnancy. You cannot be doing that in pregnancy. So before you read anything on the internet or decide to pick up anything, please contact your doctor. Like, your doctor has your best interest first. And, Rebecca is in Italy, for people who are joining. She's a medical doctor, specializes in obstetrics, and she's doing telemedicine. So your doctors are still available for you to contact if you are considering taking something. You want to talk to your doctor, but 100% good quality sleep, good quality food, and keeping your stress low, which also includes not watching everything on the news and stressing yourself out about this. Like, keeping stress low right now also means not stressing out about coronavirus. And there's lots of people who are thanking you for the information you're sharing.
I want to thank everybody who's online right now, because it's them who we have to thank, because they want good information and they're listening to our words. So thank you all for being here now.
Yeah, thank you guys so much. And if you guys are appreciating what she's saying, throw her some hearts, put some hearts up in there. Oh, here they come. So
it's my first live, so I'm kind of excited.
Yeah, you're doing great. I wasn't going to out you, but you guys, this is the very first time she's done an Instagram live. I'm so grateful that when I asked you, you agreed to come on. Right now there's been an issue with censorship happening all over social media platforms. And what we're seeing is that licensed healthcare providers aren't actually being able to get their information out. And yet things that'll be popping up in my feed are, you know, these outlandish things of like, everybody just drink ketones, it cures coronavirus. And I'm like, there's no study to show that. We have to be very, very cautious right now, because people need to be investing in quality food and be investing in their healthcare. You know, your guys' economy is different than what's going on in the United States. People don't need to be investing in, you know, $200 protein powders thinking that that's going to be some kind of cure. There is no cure for coronavirus except for your immune system to build antibodies, to get over it, and for you to become immune. Doctors are working really, really hard on this, but the best thing you can do right now is exactly what Rebecca shared, which is sleeping, eating well, and you moving your body as well. And I'm sure that's important for pregnant women as well, to be making sure they're staying physically active, even within their own home.
Yes, it is. Also because you have to remember that pregnancy is a natural event, but as we said before, natural things can have some side effects. And one of the side effects of pregnancy is making your blood a little bit thicker. So if you don't move around the house, you risk getting some blood clots. So what I would recommend women who are pregnant right now is to move around the house. Don't stress yourselves too much. I mean, you don't have to be doing, I don't know what type of physical exercise, you know, Zumba or stuff. You just need to walk around and keep your bodies active. It's good for your health. It's good for keeping your heart rate to the right pace, and your babies are hearing the sound of your heart, and that influences their heart. So that's another point. Don't get anxious, because you're going to make your baby anxious. You think he or she doesn't understand, but he or she feels your heart rate and then gets anxious as well, let's say.
Yeah.
So please get good information and don't panic.
Yeah, and for you guys who are like, well, how do I not get anxious? I have posts here on Instagram. I put up information at drbrighten.com. I talk about things about mindfulness, meditation, deep breathing. I've actually been telling, there's a lot of people who are like, I can't do meditation. I can't do deep breathing. I don't want to do that. Like, that's not my thing. I've actually been telling people, buy some bubbles and give yourself something to do and practice blowing bubbles, because you have to take a deep breath and then you have to blow very slowly to make that bubble form. So get yourself some bubbles, guys, if nothing else. But people are asking, what is it like right now in Italy to get access to fresh fruits and vegetables?
Yeah, I saw that question and I really wanted to answer to that question, because shopping is something I want to talk about as well. We have access to food. Shops get food, you're able to buy, you're able to shop. So what I don't want to see happening, which has happened in the beginning in Italy, I don't want to see it happening in the United States. And I've seen some pictures which tell me it has already happened there as well, is going to the grocery store or into the supermarket, buying whatever you can buy, leaving nothing behind.
Yeah.
Because we're talking about social distancing. What does that mean? It means not getting into contact with too many people, not going into too many places. That means also when you go shopping, if you leave nothing behind, the person who comes after you will find nothing. He or she will have to go multiple times to the supermarket to try and shop what he or she did not find before. So please do not be selfish. Buy what you need. Try to be smart and buy for the week so that you can reduce the times you go shopping, but leave behind for others as well, because you will have access to food. The world is not ending. The world is in a crisis, a big one. We have to be careful. We have to act correctly. But if we all take care of each other, then we will have access to food, and we'll have access to medicine. We'll have access to all we need. We just need to be careful and socially responsible.
Absolutely. And it's something I really appreciate you saying. The world is not ending. People keep comparing this to the Great Depression. This is not like the Great Depression. There's no food scarcity happening right now. And there's a lot of people chiming in on this right now, talking about, you know, how they're going to the store and they're not finding food. You know, in the United States, there's lots of places that do have delivery services for produce and, you know, for all of your groceries. I encourage people to use that, to be using delivery services if it's possible, so that you're not out and about. But you make a really good point that I haven't seen anyone talk about, and that is, you buy up everything in one store, that person may be forced to go to 3 multiple stores. And if by chance they are carrying and they are contagious with coronavirus, they have now gone through 3 different stores with 3 different cash tellers. So people who collect the money, I don't know what you guys call them there. And those people are now coming into contact with even more people. So that's
Exactly.
a really, really good point. And I have not heard anyone make that. So you guys really spread that information. I think that is really so, so important. So I see lots of people from the United States who are chiming in here right now. You're in Italy. You guys, you ended up with coronavirus outbreak before we saw it hit the United States. We have had more time than you, and we have failed in a lot of ways, but we still have a bit of an opportunity here to try to get ahead of this. What would you want to say, being in Italy with what you've seen, to people in the United States to help them get ready, or what you would want them to know?
Okay, I would like to see less talking and more action. We failed on this part in Italy, mainly because we weren't expecting this type of massive epidemic that happened. We saw it happening in China, but China was so far away from us, we thought it would never come to us.
Yeah.
Then some cases started popping up, and the government said it was a flu, as the whole world has been told. This is not a flu. This is something new. We don't have many options to fight it. The best option is our own immune system. So if you want to protect yourself, if you want to protect others around you, your family, your neighbors, your community, and the rest of the world, I'm not trying to exaggerate here, you know, I'm saying the truth. This is a pandemic. I'm not trying to be tragic. So if you want to save the world, if you want there to be a tomorrow for you, for your children, for your mother, your father, then you must be socially responsible. This means we need to have the least number of cases at one single time. So we're all talking about flattening the curve. What does this mean? If we have 10 ventilators, if we have 10 beds in an intensive care unit, we can have 10 people at a time having this type of care. So if we have more, I'm just saying 10 as an example, as a simple example.
Yeah, absolutely. Yeah.
If we have more than 10 people, if we have 11, 1 dies. If we have 12, 2 die. So if at the same time we have 10 beds in an intensive care unit, if we have these 10 beds and we have 100 people needing these 10 beds, then 90 people die, okay? If we have, so let's say we have this 100 people all sick at the same time. 10 have the chance to try and survive. 90 will definitely die because they don't have access to the cure. They don't have access to the breathing, let's say, help that can take
to just
can give them
oxygen,
the
something
time,
you take for granted.
To give them the time for their immune system to recover from the disease, because it's just taking time. It's just giving the chance to your immune system to get better. So 100 people, 90 die, 10 survive, let's say, in the best chance. If instead we get sick 10 at a time in 10 weeks, it's always 100 people, but all of these people have had the chance to recover. All of these people have had the chance to breathe and to let their immune system recover from this infection. So what can we do to make sure we have the least number of infections at the same time? Social distancing, staying at home, no social gatherings. It's going to be hard. We're not used to it because we're so socially connected. We're so used to having everything at our disposal that we actually have lost the sense of family and of staying home and of chilling. Please, please, please. I know it sounds like something that won't make a big difference. This is the key to helping the healthcare system. I don't know much about your healthcare system. I mean, I know it's excellent, but what I know is if you don't have the money, the insurance, you do not have access to some type of cures. In Italy, we have an extremely well coordinated healthcare system. It's public, it's free. Rich people, poor people have the same access to the same cures. We are on our knees, if not worse. So take my words very seriously. Try and be as careful as you can. Wash your hands. Wash the produce you bring home from the shopping. I've heard people say there's no need to disinfect the things we bring home. That's not written anywhere. The World Health Organization hasn't written you must disinfect your shopping. But in my personal opinion, we should, because recent research has seen that this virus can survive on surfaces such as plastic for 3 hours, days. So, I mean, if you're bringing home something that is in a plastic bag and it happens to have coronavirus,
yeah,
you know, like touching, every time you touch it and then you might, you know, eat it, it's going to give you the infection, even if you're staying home. So please be clean. Please use just one pair of shoes outside. Please do not go outside if not for a real necessity, because you must go to work, because you really need to go to see the doctor. And every time you need to go and see the doctor, please call beforehand to see if it's really necessary or not. We in Italy have prescriptions that can be made by email. I'm sure you do too. So sometimes there's no need to go to the doctors to get the same prescription over and over again. Like if you're on, if you have diabetes and you need your therapy and it's a continuous therapy, you don't need a new evaluation. So there's no need to go to the doctors. You just, you know, set a telephone appointment and you ask for the medicine. And I'm sure you'll be able to get it even without having to go around the town and risking getting contaminated.
Well, and we've got some prescriptions that will be mailed to people. I'm advising everybody to get 90-day supplies of their prescriptions, and not because I believe we're going to run out of prescriptions, but over the next 90 days, if you don't have to go to the pharmacy, you're going to reduce your exposure, but also the burden on the pharmacy. Where do sick people go when they're sick? They go to the pharmacy. They want to pick up cold flu medications. If that's something that you rely on, make sure you have those on hand as well, because remember, it's while we're all focused on coronavirus, it is still cold, flu, and we are heading into allergy season. So there's other things that you may need to have on hand. You may not contract coronavirus in the next coming months, but you may end up with an allergy flare and you need allergy medication. So try to think ahead and have things on hand so that you're one less person in that pharmacy line. You're one less person exposing other people. And yes, someone's saying there's telemedicine too. There absolutely is. Rebecca, she is a medical doctor who is in Italy for people who are joining us, and she is practicing telemedicine. She has many pregnant patients because she focuses on obstetrics and gynecology. She has many pregnant patients right now that she is managing over. Are you doing it over the phone or are you doing via video?
Both. Depends
okay, so
on the patient.
Yeah, and absolutely, you know, if you're in the United States now, ask your doctor if that's an option. You know, as we were talking about earlier, if you guys missed it, you want to go back and watch the beginning of this, that pregnant women, they need to be doing the same things as any average woman. And something to keep in mind about pregnant women is that, you know, the average pregnant woman is in that age demographic that is at lower risk. So that's another thing to keep in mind, is that you may be in that age group that's at lower risk, but your social responsibility and your responsibility to keep yourself safe is still the same as anyone else. Now, a question that's been coming up a lot are people asking about, well, I was planning on getting pregnant this year. Should I not get pregnant this year because there's coronavirus? Have you had any patients bring that up to you, and what do you advise them?
Yeah, fertility treatments, because I work in fertility, right now are stopped because, you know, you have to be followed multiple times. So right now we don't have the resources, and it's best for the patients not to come too often to the office. So all the world of infertility and fertility treatments should be paused until this pandemic is over. Apart from that, I mean, I can give you my personal belief.
Well, and we
doctor-wise,
can always caveat with that.
I mean, there's no medical reason not to get pregnant. my personal opinion as a woman and as a doctor is I would not want to get pregnant right now, because remember that what's the environment in your uterus is the environment, like your hormones, all the environment that you have in your body. And right now, I would feel so stressed and so sad of the world situation that I wouldn't want my baby to develop in this kind of, environment. Another thing is, if you already are pregnant, try to keep your environment, like the uterine environment, the best you can. Do the best with what you have. Having a baby is a great joy and you're a lucky person. But still, if I were to program having a pregnancy right now, I would try and postpone it up until we know a little bit more about this virus and how we're going to tackle it. And since you have the option, to say no right now, no, I would postpone it. But this is my personal opinion, and I don't want people to say.
Well, I think this is important.
It's not a medical recommendation. I mean, it's just my personal opinion.
Yeah, so here's what we need to clarify for people. So number one is all fertility treatments have been stopped. If you need advanced reproductive technology, you are not going to be able to receive that right now. And the reason for that is because the multiple visits that have to take place, it's been shut down here in the US, in Italy. And for people who are joining, this is Dr. Rebecca. Is it Angelica? Is that how I say your name?
Angelica.
Angelica. Yeah, I think I said that earlier, actually, and then I just messed it up. So she's based in Italy. She is a OB-GYN, and she focuses in fertility. So she does fertility treatments, and she cannot do those right now. And that is because the government has said stop, and all of the governing bodies have said stop. Now, when it comes to natural conception, what she's saying is very important for women to hear, because we do have good data on this. Mothers who become pregnant during very, very stressful events have children who can have maladaptations to stress. They can be primed for stress. So we've seen this, in studies, that have come out of really stressful times. Women are very, very pregnant. What happens with their children is their children are primed to go into that fight or flight mode. So while the average person can maybe go into fight or flight mode and come out of it, they can have a normal stress response. These children that are born to mothers during the times of heightened stress, that is, if you got pregnant right now, if you're already pregnant, understand that there's so much in your control to help modulate your stress. There's so much that you can do around that. But that is just something that's worth considering, is that if you're already an anxious person, if you're already feeling incredibly stressed out, you may not even be able to get pregnant because your body will shift your hormones to choose survival over procreation and fertility. And so if that happens, it doesn't mean that your body is broken, and it shouldn't be another place where you're focusing to add stress. And I'm sure you see this where women get really stressed. Like, you guys, when I was 30, I was like, oh, I never want a baby. I never want a baby. I turned 30 and I was like, I need a baby in my arms right now. When you want a baby, you want a baby right now. And it can feel incredibly stressful when you can't get pregnant the first time, the second time. So it's really important right now for you to reduce your stress as much as possible and understand that nature has an intelligence in this. And if you are really stressed, it knows this might not be the best time for you to have a baby, and it will keep you safe and help you and then you can do things to help you get ready for a future pregnancy. So don't think anybody should be hearing this and thinking like, oh, the World Health Organization has said stop all pregnancies. That's not what we're saying. No. But what we are saying is that, and I agree, from my opinion, now is not the best time to try, because we also know that when there's stress and other things going on, we can see increase in complications, we can see increase in miscarriage rates, and we don't want that for any woman right now. We want all of you to stay safe, to be healthy, and we want you to have healthy babies for sure. And yeah, there's people saying, I heard this disrupts ovulation. Stress can absolutely disrupt ovulation. Stress can cause your progesterone levels to go low, and which is absolutely essential for having a pregnancy. So, it's just really important to understand that, there's things outside of just, can I get pregnant, that should be considered. Now, there's a question here about a colposcopy. and they were supposed to get a colposcopy before this happened. And so Just Organic Love, I do have an article all about HPV and how to support your body. Your immune system can clear HPV, but if your doctor's recommending a colposcopy, I would say you should definitely talk to your doctor about what your next steps look like. Anything that you would add?
Also because it really depends on why you need the colposcopy, because the pap smear results are multiple, and you could have a result which basically means we don't really know if you have something or if you don't. So we would want to have some more data, and they put you in for getting a colposcopy. Or there are results which say you have low-grade dysplasia, which means your cells are starting to become less normal, but in a low degree of change, or mild degree of change, or high degree of change, or they already see some cancer cells. So there are really so many options of a pap smear result which can bring you to a colposcopy. So I would contact your gynecologist and ask why. What is the question for going into a colposcopy, and if it's a low-grade dysplasia or a doubt, I would think you could postpone it for when this crisis ends. Something that has been seen with research, with scientific research, is that if you take folic acid, which all women in fertility age should be taking already, it supplements your immune system, and it has been shown that you sometimes can get rid of the dysplasia, the low-grade dysplasia, and the small modifications of the cells you have, and the HPV infection, also by supplementing with folic acid. Another important thing, the cells in your cervix, which are the ones that you go and check with the pap smear and the colposcopy, are very sensitive to smoke. So if you smoke, your immune system locally gets less efficient, and you're giving your body a lower chance of getting rid of the infection by itself. So I would recommend stopping the smoke.
Yeah. No, that's in my
and taking folic
article.
acid.
I'm like, number one is you need to stop smoking. And yes, people are asking about, like, if you have MTHFR, you can't take folic acid, then you take folate. So you look for a methylfolate, a folinic acid, a nature folate. So with an MTHFR mutation, if you can't take folic acid, then you replace that with folate. But the research has been done on folic acid, so I think it's important for you guys to understand. The questions are just coming in about that, but the research is done on folic acid. So when we state what the research has said, we are being accurate in the language to say folic acid. But for you, if you have a genetic issue with utilizing folic acid, then you would opt for folate. And that's going to be the same nutrient that you're going to need if you are planning on getting pregnant. And, what's interesting, though, is that the other things that help with our immune system with coronavirus are the same things that help our immune system with HPV. So a lot of what we were saying, you guys, reduce your stress, make sure you exercise, and then, yes, quit smoking. You have to quit smoking. Some people were asking, there were several questions that came in and said, so folic acid, you guys, is B9. You can go to drbrighten.com. I've written about folic acid many times. There's also information here on Instagram that you can read about that. So people were asking, does stress impact your egg quality? And is there any concern around that?
Sorry, I didn't hear correctly the question.
Oh, it's stress. Being stressed right now impacts the quality of their eggs.
Yes, it does. Because as we said before, the hormonal cycle, when you're stressed, has malfunctioning, basically. So the quality of your ovulation, you might not even ovulate. So it does have an impact on trying to get pregnant. And the fact that in a stressful period you don't get pregnant really is not, let's say, important for a diagnosis of infertility. If you don't get pregnant during the coronavirus outbreak, I wouldn't be worried.
Yeah.
I mean, it's most probably due to stress. Stress is something that we call a feeling, but that in our body is a biochemical reaction, and it's due to hormones. So since you know the ovarian cycle is regulated by hormones, and stress is another type of hormone setting, you can see there can and there usually is a relationship and an interaction between the hormones that you develop in your body. So yes, stress and all things that are correlated to stress. So not sleeping well, not sleeping enough, getting your levels of cortisol, which is the hormone of stress, too high, that can all impact on your fertility and on the quality of your eggs as well. Yeah.
So guys, this, I know there's more people jumping on here. I appreciate you answering that question. This is a great conversation that we are having here. And if you guys have any questions, Rebecca is focused on women's health. So she's a fertility specialist. She's a medical doctor that specializes in gynecology and obstetrics. If you have questions about pregnancy, postpartum, getting pregnant, this is what we've been answering, and feel free to ask questions. Now, another question that's been coming up is coronavirus being transferred to baby and in utero and via breast milk. What do we know currently?
Currently, we have no evidence, no scientific evidence supporting the transmission through the placenta. And there have been no cases of newborns from coronavirus infected mother of a transmission in the uterus. But if you do have coronavirus and you're breastfeeding, the recommendations are you wear a mask, so you have respiratory hygiene. You wash your hands before touching the baby and after touching the baby. So basically, it's the same type of advice we give to the rest of the population, but with the extra factor of wearing a mask when you're breastfeeding. Because as you know, this virus can be transmitted by the little droplets that we have while we speak, while we breathe, if we sneeze, if we cough. So it's best to try and keep your baby as safe as possible, because when they're newborns, they have let's say your immune system, a little bit of your immune system, because they have some antibodies. You've passed them during pregnancy and the ones that you pass on during breastfeeding. So breastfeeding is still recommended. Yeah. But you need to try and be as clean as possible, not to pass the infection over, because you still don't have those antibodies. So your baby won't have those antibodies. So please continue breastfeeding. Just be careful with your hygiene.
And that doesn't mean that you need to clean your breasts. You guys, when we're talking about like having things be really clean, talking about wearing a mask, cleaning your hands, this is transmitted via respiratory droplets. So, I don't want anybody thinking that they have to fully shower every time before they breastfeed, especially with a newborn, because that's like every 2 hours. And there is, on your skin, there are microbes that go into contributing to baby's microbiome, which ultimately helps support their immune system. And as you do build antibodies over time, you will pass those through breast milk, but you've got to build up your own first. And I would also say with that, this is another reason for practicing stress reduction, because if you see a decline in your breast milk, as you said earlier, drinking water, it's easy to forget to drink water. So that's number one. The number two is making sure you're keeping your stress levels low so that your body continues to produce breast milk and to support baby. And if anybody has had a baby and you've been unable to breastfeed for any reason, you've done nothing wrong. Do not feel ashamed. Don't feel like there's no place for any negative emotions or hating on yourself. Hating on yourself is very bad for your immune system. So just be gentle with yourself right now. This recommendation around breastfeeding is not meant to shame anybody who's unable to. But if you are able to breastfeed, it is a wonderful thing to support your baby's immune system and to continue to bond. And it also is a stress reducer for moms, because there is a chemical reaction and hormones released when you do breastfeed that can help with stress as well.
Okay, I've read two questions I want to address.
Go for it. I saw you were reading and I was like, I'm just going to pause, let her do her thing. And for people who are just jumping on, Rebecca is based in Northern Italy. This is why I'm bringing her on. She is a pregnancy expert here for you. She's an expert in women's health, and she is based in Northern Italy, where we are seeing some of the worst cases of coronavirus right now. And that's why I wanted to bring her on to talk to you. This isn't a US based doctor who's giving you theories. This is a woman who is living in, the biggest outbreak area, that has contact with other physicians at hospitals, who is treating pregnant women right now. And so this is such valuable information. Please tag a friend to join this so that they get in on this. Okay, she is a hero. They're calling you a hero. Okay, answer the questions you wanted to answer.
Okay, so I've read, should a woman take folic acid before pregnancy? The answer is yes. All women in fertility age should supplement their diet with folic acid, because you might not know if you're going to get pregnant tonight or tomorrow. So it's always best to have a supplement of folic acid a couple of months before you get pregnant. So if you don't know when you're going to get pregnant, just take it continuously. It's not going to harm you. It's just going to make easier for your body to build your red blood cells and to keep your immune system correct and at a high level. So it doesn't have any negative effect on you. It's just going to give you a positive effect if you do get pregnant, because it's really important in the first trimester. So take it.
So I want to speak to that though. And, everybody right now, there are jokes going around about how there is going to be a boom in babies as we all go on quarantine. And that is not to be insensitive to people who are unable to have, their fertility treatments right now, but it is real. If you are a sexually active female with a male and you are going to be hunkered down, that's why I put up a post saying, make sure that you filled your birth control prescription. Make sure you have your condoms. Make sure, if you don't want to have a baby, make sure you have what you need on hand. But this is another added layer, is that you should consider using folate or folic acid. So here comes the confusion again. Folic acid is synthetic. Folate is the natural version that people with MTHFR choose. In our prenatals in the US, most of us are recommending folate, methylfolate, the active form. Not everybody, you guys, we are speaking to a global audience right now. Not everybody is going to be able to get access to folate. And the research is on folic acid. Food is supplemented with folic acid. So I know I'm going to just do, you guys, I'll do a whole video about folate so we can just clear this up for you guys. But it's super, super crucial to understand that by the time you have a positive pregnancy test, your developing baby already needed folate. Your body already needed it. So what Rebecca is saying here is that if you are a fertile female, so you are in the reproductive window and you are sexually active with a male, you should be taking, and it's actually not as easy here in the US to find just folate, except in really high doses. So this is why we recommend a multivitamin or prenatal that does contain folate, B12. Yes, someone said vitamin D, especially if you live in the northern hemisphere, you're probably going to need vitamin D. And in the United States, we have the Vitamin D Council that provides guidelines around that. All of these things are really, really important, but the majority of research has been conducted on folate and the adverse outcomes of not having ample folate in your body. And if you are taking an oral contraceptive pill, understand that it can deplete folate in your body. So you can end up with a folate deficiency. So that's another reason, if you are on the pill and you think I can't get pregnant, know that 9 out of 100 women do get pregnant in a year period of time with typical use. So you still want to have a prenatal or multivitamin on hand, if for nothing else to keep your nutrient stores up, but also because sometimes contraceptives fail and you will get pregnant. So just to be mindful of that. Okay, so that was the first question you wanted to answer. You saw another question come up, and I want you to be able to answer that.
Actually, it's a comment. Someone wrote, there was in London a newborn baby born with coronavirus. I'm talking about the Italian experience because I'm not in London. Okay. I don't know anybody with a firsthand experience about this newborn baby. I know there has been a case, and what I have read about it was not that the baby was born with coronavirus. So it was not during the pregnancy that the coronavirus was transmitted. It was an immediate postpartum infection. So the newborn baby caught the coronavirus basically after being born, immediately after being born. So babies can get coronavirus. Children can get coronavirus. We have cases of children with coronavirus in Italy. 2 days ago, it was about 300 kids with coronavirus. What we have seen in Italy is that kids usually do not develop severe symptoms. They usually get very mild symptoms. And that's something else I want to address, because on a recent post I have placed on my Instagram account,
which is at The Gentle Lady, guys. If you're not following her, definitely do that.
Thank you. I put some recommendations on it, how to protect yourself and your family. And I believe it's like in the first rule, stay at home. I wrote, keep children apart from the elderly. It's not because I don't want nephews to be together, grandchildren to be together with their grandparents, because it's a beautiful relationship, but it's because children can get coronavirus, not develop any severe symptom, and pass it on to their grandparents very quickly, very easily, and their great-grandparents will not have mild symptoms, because what we see in Italy, because we have an elderly population, is the elderly get worse symptoms. They need intensive care more frequently than younger people. So keeping children away from the elderly is a way to protect the elderly. It's not because we want to be mean and keep grandchildren and grandparents apart. It's just because the percentage of death rate in elderly is much higher than the percentage in all other age groups. So please go and take a look at this post. I've written all the recommendations that I found from the World Health Organizations and other tips that I believe can be useful in this post, and try to follow all of these rules because they're very simple. We all have the time, especially right now that basically the whole world is in quarantine. So if you think you don't have the time to do it, it's just an excuse. We all have the time, and we all need to make time to follow these tips and to keep safe ourselves and our families and the rest of our community. Another thing I would like to add, because earlier on we talked about shopping and online shopping.
Well, before we move on to that, I just want to share with everyone that my son is FaceTiming and doing Zoom calls, Zoom, and Loom, Loom, are free services right now where you can set up. It's similar to Skype, but you know, it's a different technology. My son is doing that with his grandparents every single day. They're getting on and they're having a video chat. So it doesn't mean that the relationship gets broken. The relationship becomes a lot more interesting. And you guys, you know what you can do on some of these platforms is you can actually put on filters where your children can be wearing dog faces and all these different things. And do you know how much fun that is for a child when their grandparents put on the dog face? So it's a very unique experience that they get to have. And what an opportunity to teach our elderly technology and to have that connection. So while they can't see each other, they can still be connected. So we've got a few more minutes here. I know you wanted to say something else, but Instagram will time out on us soon. So I want to just be aware of our time.
Sure. I just wanted to say that I know that online shopping is becoming more and more difficult. Please try and organize yourselves with the neighborhood. Try and have one person that goes shopping for multiple families. This is another thing we can do to be socially responsible and to keep the elderly home and to avoid pregnant women, people with problems of immunodepression, the elderly, and the rest of the population home.
Yeah.
To stay home.
So everyone, I want to say this. It's Rebecca's birthday today. Today is her birthday, and it's
my husband's birthday.
Oh, it's your husband's birthday?
Yes.
Oh, sorry, I got that confused. But
No, no
it's her
problem.
husband's birthday, and she came on to share this information with you guys. So if you can please go follow her account. It's in my stories. It's at The Gentle Lady, and it's
Yes.
in my stories. Please go follow her account. Please share this information. I will move this onto IGTV so that it lives forever, guys, and that you can share this with people who need it. But the last big question that's been coming up is that people want to know how you're doing. How are you doing right now being in quarantine in Italy?
I'm doing well. I'm doing fine. I think that as I said before, we must be socially responsible. So I'm living this as an opportunity to do my part. I'm living this as an opportunity to make time for things I never had time to do before. Um, I want to inform people correctly, and so this is why I am exposing myself on social media more than ever
Mm-hmm.
before. Um, and yes, what I would recommend people to do if they're home, I know it's difficult sometimes to be closed in a small box all day, but finish the book you started reading and you never had the time to finish. Try and learn a new language. Take that course you wanted to know more about, but you never had the time to follow, and make some quality time with your family. And even if you don't have your family near, as you said before, there are many options in today's world to see ourselves. You know, I'm in Italy, here in the US, and we're seeing our faces and we're talking. So we really have no excuse. We can make time for our friends, we can make time for our family, even if we're far away. So I would
Mm-hmm.
recommend people to use their time wisely and to do these things. These are the things I'm doing.
Yeah, you guys, if this has been helpful, please tell her thank you. Please give her some hearts right now. You know, so many of our healthcare providers, they are on the front lines. They are shifting their practices to still serve you. Rebecca, for people who are jumping on, she's based in Italy and she is seeing her patients virtually right now. And this, I think, is a great example. You're sitting in Italy, I'm sitting in the United States, and we are having a conversation about this. Social distancing doesn't mean social disconnect. Social distancing means physically distancing yourself, but emotionally, some people are becoming even closer to one another because this is such an opportunity to pause and reconnect and reach out to people that maybe you've lost contact with. So as you sit in Italy, I just want you to know we are sending you so many prayers, thoughts, love, all the good intentions that we can. What would you want people in the United States to know right now? Or is there anything else that you would want to share as we wrap this up?
I'm just recapping things that I've said before for the people who maybe just jumped in. Uh, Please be careful. Please stay home as much as you can. Please try and wash your hands, wash your shopping, be as clean as you've never been before because it's gonna help. Um, please don't be selfish when you go shopping. Uh, please think about the fact that we don't have uh, the number of masks for everybody. So there are some categories like the doctors, the nurses, the healthcare providers that need them more than you do. So don't rush and buy all of the masks that are around because there are people who cannot do the social distancing technique and need the
Mm-hmm.
masks. Um, Try and help as much as you can your neighbors. Let's discover again the pleasure of being human beings and of having a big heart. If I can, I would take this opportunity to say, I've also written it again on my story. My husband, for his birthday, he asked for no presents, for no celebration. He would just want a donation for the hospital of Brescia, which is a hospital I have been working in up until this December. And it's one of the cities and provinces in Italy which has the biggest number of cases and is really at his knees. So if you do have some spare money, if you do have the chance to help, uh, think about donating to this hospital because it really needs all of our help.
Mm-hmm. Well, thank you so much. I so appreciate your time coming on and sharing your expertise. This is going to help so many women. I will let you know when this is available. And for everybody who is listening right now, I will let you know when it is on IGTV. I will put it into my feed, and I'm going to go to my stories. I'm going to share her handle so you can go follow her on Instagram and follow her journey in Italy right now. Thank you again so much. I really appreciate your time.
Thank you so much.
Take care.
Bye, Jolene. Thank you. Thank you for
Bye.
the opportunity. Bye.